Hello and welcome. Today we are talking about something that's killing millions. Silently. Not in hospitals and not in wars, but through a packet costing just 1 rupee. Yes, we're talking about smokeless tobacco. Gutkha, khaini, zarda. Products that are cheap, deadly, and everywhere in India. Let's break down the truth in simple words and understand why India is failing to control this dangerous habit and what we must do before it's too late. The scale of the problem.
India is home to 70% of the world's smokeless tobacco users.
Yes, 7 out of every 10 users in the world are right here in our country. According to a government survey called GATS2, 42% of Indian men use tobacco, 14% of women do too. That's almost 1 in every 3 adults in India. Smokeless tobacco, unlike cigarettes, is more popular, especially in villages and low-income communities. Why? Because it's cheap. You can get a small packet of Gutkha for just Rs 1 pong. But the real cost is cancer. Deadly health impact. Tobacco, whether you smoke it or chew it, causes many types of cancer. Lung cancer, mouth cancer, throat, stomach, and even pancreatic cancer. India now ranks number 1 globally in male cancer cases and deaths. And among all the cancers caused by tobacco, mouth cancer is the most common in Indian men, thanks to smokeless tobacco. Law versus reality. You might be thinking, isn't Gutkha banned? Yes, officially Gutkha is banned in many states, but in reality, you can still buy it at tea stalls, roadside shops, and pawn corners. The law exists, but there is no strong enforcement. Shops sell banned products openly, because no one is watching. The money problem. Tobacco is not just a health issue, it's an economic disaster. In just 1 year, 2017-2018, tobacco cost India Rs 1.77 lakh crore. That's more than 1% of our total GDP. Out of this, 74% of the cost came from smoking, and 26% came from smokeless tobacco. And guess what? The cost keeps rising every year. So India is paying with both money and lives. The prevention dilemma. India faces a tough challenge. We have high tobacco-related cancers, but also high rates of tuberculosis, TB. This makes lung cancer screening more complicated because TB symptoms look similar. So the best solution is not to wait for cancer. The best solution is to prevent it by reducing tobacco use itself. Why the policies are weak. So why hasn't India acted strongly yet? Because of policy resistance. The tobacco industry is powerful. They use clever tricks to keep prices low, interfering in policy decisions, marketing to youth, dense networks of shops, and a lack of political will. Even the 2024 union budget made no change to tobacco prices. So as people's incomes rise, tobacco becomes more affordable, not less. Cheap and easy access. Let's talk about prices. Betas cost as low as Rs 5, Gutkha and khaini, as low as Rs 1. Even cheap cigarettes, available for Rs 5. Plus 87% of cigarette shops sell single sticks. This means people don't have to buy full packets. They can easily avoid seeing the health warnings. This also feeds into the popular chai suda culture, especially near tea stalls. And for daily wage earners earning 170 a day, even Rs 5 tobacco is affordable and dangerously addictive. What needs to be done? So what's the way forward? Let's break it down clearly. 1. Raise taxes. Taxes must rise faster than people's incomes. This makes tobacco less affordable. Currently, our taxes are only 35% of MRP. Who says it should be 75%? 2. Ban single-stick sales. This will ensure people see the graphic warnings on the packet. It will also reduce impulse buying, especially among young people. 3. Use tax revenue for health. Money collected from tobacco taxes should fund cancer screening camps, awareness drives, free treatment in villages. 4. Stricter enforcement. Regular checks, strict fines, and better monitoring are needed. Shops selling banned Gutkha must face consequences. 5. Plain packaging. Make all tobacco packs look dull with large health warnings. Remove flashy designs that attract young customers. 6. Regulate shop locations. Stop tobacco sales near schools, tea stalls, and public places. This will help break the chai sutta routine. 7. Early detection and cessation support. Along with prevention, we must help people quit. This means investing in tobacco quit lines, free counseling, easy access to early cancer tests. Conclusion: Tobacco is not just a product when it's a public health tragedy. Every packet sold, every puff taken, every Gutkha chewed is a step towards a slow and painful death. But the good news, we can still stop it. Through strong laws, fair taxation, better awareness, and community support, we can save millions of lives and lakhs of crores in the process. Let's make tobacco less affordable, less available, and finally, less acceptable.